All right, hey, my name is Roderick, and I'm here to talk to you about genital herpes, HPV, and AIDS, which are all virally sexually transmitted diseases. So the big thing about viral transmission versus bacterial transmission is these ones are a lot harder to treat, and some of them you can't get rid of. So, yeah, let's start with genital herpes here. This is also known as herpes simplex 2. And one of the bigger things about this, especially like in utero, if a woman is pregnant, she doesn't automatically pass that to her fetus in utero. So that's good. However, if she has open lesions or what we call an outbreak, even if it's like a little tingle or something, that's going to be a C-section because we don't want that baby to pass through the birth canal, get those secretions on, boom, now he's got it. You know, you want to give the baby a chance at least. Another thing is that if he does come through that birth canal, she's got an open, lesion or she's active, in an outbreak, if that newborn gets an infection from that, it can be a systemic issue and result in death. So not only, you got either a newborn who just got it or, gets a systemic infection and dies. Both bad options. I think everybody knows herpes is characterized by these little vesicles or fluid-filled tiny sacs. And in this case, it's HSV2, which means it's going to be in the genital area. However, it can be, up here too, but that's HSV1. So we're worried about down low. That's going to be labia, on your vulva, on the man's penis. It can be on the scrotum, kind of around that area. It can be in the anus. It can be in a girl's anus too. It's, yeah. You're going to have like these fluid-filled sacs that sort of fill up and then they burst and have this big burning, tingling, itchy lesion that goes away initially. Once you first get it, you contract it. It takes about 10 to 12 days to get rid of on average. Could be a little bit shorter, could be a little bit longer. But genital herpes is kind of sort of characterized by these remissions and outbreaks. So it's like, it doesn't ever really go away. Even if it heals over and it doesn't pop up for 4 or 5 months, you still got it. You might have the chance for an outbreak. So treatment with this is you're going to be on a medicine to basically reduce the outbreak and the severity of the outbreak. So the number of outbreaks and the severity of the outbreaks has been reduced by acyclovir or Zoravax. It doesn't go away. This is a viral bacteria or viral STD. These are harder to treat because a lot of them don't go away. So, sort of the education is you're going to take a pill consistently to minimize the outbreaks and how bad they get. That's about it. So moving on to human papillomavirus. This is the most common STD around. Not herpes, not AIDS, not chlamydia, not gonorrhea, not any of the things we covered today, not anything Brittany covered or Suzanne covered. This is it right here. There are over 200 types, but for today, only 4. What we're going to focus on are the 40 types, or specifically 4, that can cause an infection in your genitals or your like mouth and your throat. So most people who have sex get this. Period. They get it because it's out there. It's that common. In most cases, they clear up. You didn't even know you had it. Don't cause any issues. It goes away. But the 4 we're going to talk about today, we're going to start with HPV 6 and HPV 11. These are what we call low-risk HPV strains. Why? Because they cause genital warts. You're saying low risk? That's because they cause genital warts and not cancer. So, yeah, it's a viral infection. Yeah, you got genital warts. But it's more of a cosmetic issue since it doesn't really cause any sort of cancers or anything else. You can spread it still, but it's relatively low risk. You can also get rid of these growths, which in themselves are harmless, by the same kind of way you can get rid of plantar warts or something. Freeze them off, cut them off, kind of go away. Now, getting to the real big bad ones here, HPV 16 and HPV 18. These are ones that are associated with cervical cancer and cancer in general. So you can get cancer of the penis, cancer of the cervix, that's cervical cancer. You can get cancer of the, just vulva, anus, throat, stuff that you didn't think you could get cancer in all the time, from this at least. And again, with these, that's what that annual pap smear is for. You want to make sure that it's, you're screened for it, so you can do something early about it. You can treat these too, but it's viral, so you don't really get rid of it, but you can kind of get rid of the abnormal cells that cause the cancer. So there's cryotherapy where they freeze and get rid of them, or there's this thing called LEAP, which is loop electrosurgical excision procedure. So you can get rid of it via that. But the big thing about HPV is, since it's so common, since a lot of it's asymptomatic, and even the genital worst thing, it's relatively low risk, the big thing is prevention. You gotta get the vaccine to prevent it altogether, because condoms and dental dams and hoping and praying ain't gonna get it done. You've gotta get the 2 series or 3 series Gardasil. If it's Gardasil 4 or Gardasil 9, that's the only way to prevent it. So you gotta get the immunizations. The only methods, the other condoms and dental dams, like I said, hoping and praying, teenage, impunity, nothing's gonna happen to me. It's gonna happen if you do this, if you have sex, period. So you gotta get the immunization to prevent it, because treatment is different than preventing it altogether. Last one, HIV/AIDS. AIDS is more of a syndrome that's piggybacked off of the HIV virus. That means that you don't have those helper TD4 cells, which sort of coordinate all of your immunologic response. So if you don't have those, you can't really respond to the viral, bacterial, or fungal infections you got. So there's 3 categories of this. You have a mildly symptomatic kind, which means you're HIV positive, and you have these sort of recurrent, frequent ear infections or respiratory infections, and an enlarged spleen. But that all goes with the positive HIV diagnosis. So if you have a bunch of ear infections, you're straight. If you have a moderate, severity or symptomatic, moderate symptomatic version, that means you're going to have the positive HIV diagnosis with like a persistent fever, or maybe like a pneumonia, or that thrush. And then if you have severely symptomatic one, that means you got a positive HIV diagnosis with encephalopathy. That's some terrible stuff right there. Tuberculosis maybe, and failure to thrive, which means you're not living. You're failing to effectively stay alive. Treatment, antiretrovirals, in support groups, because people have a sense of like hopelessness and loneliness, because that's a struggle to have and go through. And obviously prevention is avoidance of unprotected sex. Don't abuse IV drugs with sharing needles, and limiting your sexual partners. It's pretty much prevention on that. But knowing your status, doing all that kind of stuff always helps too. So my NCLEX style question is: the healthcare provider is teaching a patient who is diagnosed with genital herpes about the disease. Which of the following would be included in the teaching plan for this patient? Select all that apply. So which one do you think you guys think it is? Because I think it's C. There is no cure for genital herpes, but outbreaks can be shortened with medication. And I have a little infographic, and let me just tell you how old that is. HPV is the most common. I know this is the question about herpes, but what does that say? 14.1 million new infections. That's old. That's from 2013. So it's out there. Now I'm going to pass the baton either to Brittany or Renee or Suzanne. So thank you.